Good evening and welcome once again to our monthly COVID-19 webinar provided to you by the COVID Task Force from our second district of Omega Psi Phi Fraternity Incorporated. My name is Kelvin Ampofo. I have the honor, I have the pleasure of serving as the second district representative. You have a special treat. This is a pre-recorded program on this evening. So any chats, any questions that you have, we'll have some doctors monitoring, but we just want to let you know we're bringing you a special pre-recorded edition for our monthly COVID-19 webinar. Certainly to those of you that have been with us from the beginning, we certainly want to thank you for your support. I'm going to introduce the brothers we know in the second district, as well as the entire fraternity that have helped us throughout this entire pandemic. We want to salute, we want to honor our brothers in the order of which they joined our illustrious organization. We're going to start off from 1978. Dr. Boykin, you know, he has been giving us stats and sometimes every week. Then we got to the point where it was every other week, and now we came up with this monthly webinar. So Dr. Boykin has always provided us the most up-to-date information as it relates to stats, and most importantly, a pediatrician telling us about our kids, things that we need to be aware of for the kids. So Dr. Boykin, thank you so much. Let's not forget next 88, Dr. Jadan Phillips. Remember, Dr. Phillips was at the epicenter of this pandemic when it all began. And so we were getting live updates from New York City right here from Dr. Phillips. So Dr. Phillips, we salute you. Thank you for all the information you provided from the beginning. And we certainly looking forward to tonight's discussion as we continue to move forward. Brother Wonzie Gardner, this brother has shared a powerful story of how COVID-19 has impacted him personally. He has shared with us his experience throughout this pandemic and has found it to be not selfish. He ensured that even though he was going through personally, he made sure that all of us continue to have the most up-to-date information, letting us know how the government was responding. And so, Brother Gardner, we certainly thank you. We certainly are glad that you're here, and we're looking forward to the information that you have. Certainly, last but not least, 91, our friend, our doctor, the pharmacist, Cedric Guyton, who has been simply amazing, giving us the information as it relates to the pharmacy. And so, Dr. Guyton, we just thank you. We applaud all of you because you didn't have to do this. From the time that this pandemic began, you all saw fit to make sure that first, the brothers of Omega Psi Phi Fraternity Incorporated had the most up-to-date information as it was coming to us. But then you unselfishly said, let us reach out to our communities. Let's make sure that everybody knows about this pandemic. We wanted to make sure we heard it from doctors, and most importantly, we wanted to make sure we heard it from doctors that look like us. So before we get started, again, special edition. This is pre-recorded. And again, all the comments you hear tonight, they don't necessarily reflect the views of Omega Psi Phi Fraternity Incorporated or any affiliation of which these doctors or employees may be affiliated with. They are speaking of their own free will. And so with that being said, let's start off. Dr. Boykin, if we were to say where we were when this thing started, to where we are today, to things that we still need to be cognizant of as we look forward. Please give us your thoughts on that, Dr. Boykin.
Well, well, first of all, good evening to everyone. I would say that when we started this thing out, well, back in spring of 20, around February, March, it was a mass confusion. So much information was being passed on that we didn't have answers to, and people were scrambling trying to figure this thing out. People were afraid. People were dying. People were being hospitalized, and so the professional community had to scramble and deal with this. The scientific community had to scramble and deal with this, and so as time went on, we learned more things about it. But I know in the beginning it seemed like we didn't know what we were doing because we just didn't have all the data at that particular point in time. Now, as time has gone on, we've come together, we've coalesced, and we shared data, and we have a lot of data points that we can recognize now, particularly on the medical field. And in my particular instance, as a pediatrician, that population of patients, or that population of the COVID-19 pandemic, was basically ignored in the beginning, because nobody thought kids were going to be vulnerable to the disease until we saw how things went on. So now we know that kids were vulnerable to it. Cases are probably much underrepresented, underreported, but now we see the impact of it. But the good news is that we've learned that children do fairly well with it. So, but all those things needed to be brought together, and it's over time, over these last 2 years, with some diligence in the medical and scientific community, we've gotten all these things together. I think we have a great armamentarium going forward. So I'll just pause there for anybody else that wants to chime in and give me their thoughts.
Dr. Phillips, please. I mean, again, you were there, the epicenter. I mean, you were giving us live information right from New York when this all began. Your quick intro as far as where we started, where we are now, and anything you want to share. Dr. Phillips, please.
Well, first, I would say good evening, everyone. Again, good evening, my brothers. It's been an honor and privilege and pleasure to work with you throughout this time. Yes, in New York, we were hit very, very hard back in the beginning in the early part of 2020. February, March, April, May were the climactic months for us as far as the number of cases. But as Dr. Boykin just alluded, we have developed tools to protect us. And I think what we're now seeing is a transfer from this being a pandemic to being something more endemic, meaning something that is going to be in existence, and we're going to have to figure out how to manage it with it still being present. And I think, as Dr. Boykin just said, we have got quite a few tools to help us, and we have the ability to assess our own personal risk. So what I'm seeing now is in my office, when we were establishing special clinic sessions for individuals that were suspected of COVID, we're not doing that anymore. We're seeing, some of the mandates. I know with the schools, they are now making it, up to you if you want to wear a mask or not. It's not mandatory. And we're seeing that they're very well going to be rolling back some of the vaccine mandates. However, with the newer variant, the BA.2, we are still seeing that it is very transmissible. In addition to that, it still seems to have an impact on the most vulnerable being individuals, number one, that are not vaccinated, or if they're eligible for booster, but also our elders and individuals that have health conditions that compromise their immune systems. So again, if you are one of those individuals, or maybe living with someone or in contact with someone like that, you still got to be very mindful of how you protect yourself out here, because COVID is still here. And unfortunately, the cases that we do see that go into the hospital, a lot of them tend to be individuals that have no vaccine, and also individuals that are in those vulnerable categories. So with that, I'm going to fall back for a moment and let my other brothers, give their commentary. But thank you very much.
Brother Wonzie Gardner, as I mentioned earlier, from the beginning, you've been here. Obviously, you have a story that no matter how many times you tell it, it still touches all of us. We think about you every day, my brother. Uh, Please share with us your COVID experience from the beginning to where we are now, and most importantly, as you've always done, share with us, as far as you've always brought us the information as it relates to the government, any insights on from where the government was to where we are today, to what we're going to be looking for down the road.
Brother Dr. I thank you for this opportunity, and I think I'm just honored to be amongst my other brothers. This has been a long journey, and as Brother Boykin said, we are hoping that we return the corner. We don't know whether or not this is a pause, or is this something real, or we're going to have another wave. As I sat back and reflect on what you asked, a lot of us are going to walk away from this as in a period or an event, something that happened, and others of like myself are going to be stained and marred for the rest of our life. We're going to carry a burden that only time will tell whether we get over it, not get over, but learn how to live with it, our new normal. As I've told you guys, I lost mom and my daughter and dad all in this period. Mom directly to COVID, my daughter semi because she could see get medical help. And so COVID will always have a place of infamy in my heart. And so I'm trying to deal with it. And like you said, we started on this journey not knowing where it would take us or the tragedies we'd have both personally and collectively as we dealt with this. And we tried to provide information to this body and others about what the federal government was trying to do as a way to help others and also as therapy. When you're hurting, you try to find a way to reach out. I want to give us a few statistics to put this in perspective. This has been the deadliest event in U.S. history. In November of last year, we passed over 700,000 deaths. We're up to 974,000 deaths. So just to put this in context, in the American Civil War, which was next, we only had 750,000 Americans die. In the 1918 influenza pandemic, we had a little over 675,000 die. World War II, 405,000 Americans died. And World War I, 116,000. So we have become immune to these numbers because so many have died. But we have not had an event in these United States that have killed so many Americans. Globally, we have lost more Americans, more people than anyone else. And so my message to those brothers out there who have suffered like me and know people that have suffered, this is real. It's not going away, and the scars are permanent. And my prayer is that this collective body has given information, given perspectives that might have helped save somebody or make someone's change their mind about getting a vaccine. And Brother DR, this became very personal to me early on. It's still very personal. So as we talk about turning the corner, just want to remind us that there's some people out there like myself that are going to be forever marred. If we don't have another case, we'll be forever marred for the rest of our lives for having experienced this COVID pandemic. Thanks, Brother DR.
Thank you, Brother Gardner. And as you already know, we're always here for you, my brother. And we just appreciate you, man. Despite what was happening, you still took the time to make sure that your brothers and the community was aware. And so, man, we just say bless you, man, and we appreciate you. Dr. Guyton on the pharmacy side. So all this talk about vaccines, right? Everybody was thinking that they were talking about or that they knew what they were talking about, right? But you always set us straight, Dr. Guyton, didn't you? You always let us know what was really happening. So please, where we started, where we are, talk to us, Dr. Guyton.
Brother DR, I want to say it's been an honor to sit here for over 20 months with our esteemed brothers on this call to try to save one life, one day at a time. No one knew we would wake up one day in the worst pandemic ever in the world had hit our shores silently and unseen and without a vaccine or a cure. I want to take a moment to first, everyone on the sound of my voice, please understand, we have 972,000 people who have gone from this earth or more because the statistics are still being calculated because of some of the secondary causes that this virus has caused death that we haven't fully accounted for. We could have over 100 million people die. Let's be very, very, very understanding of those 972,000 that have gone. We could be over this pandemic in no time if we had followed some of the mitigation strategies. I want to make sure that we take a moment to really reflect on the first time we heard that there was a silent killer that could kill you in 2 days, that your body could shut down and you could drown and suffocate in a bed and you never would see your family again, that you would put in an intubation tube and you would never come off an intubation. And there was no cure. Let's reflect upon the fact that the mechanism of the American government, its system, put together a great program called Warp Speed that allowed us to have not the cure, but a preventative method called vaccines that have slowed down the death rates and hospitalizations. As we've understood in the past, there's a lot of hesitancy, there's a lot of misinformation, but let's be clear. Vaccines will save your life. This vaccine has saved lives. These vaccines will continue to save lives. We have not gotten a cure for this virus, but understand the best way to survive this with your comorbidities is now through the vaccines. This virus causes a very high mortality rate. And what we have to understand now is how the morbidity of this virus is going to impact our entire lives. Being that it will be endemic now, we're going to have to start looking at the incidence and prevalence and how it's going to impact some of the secondary chronic diseases that our people or in our communities are having, such as COPD. It can impact a number of things: our diabetic patients, our hypertension. Anything that you know of as a chronic disease can be impacted by this virus. So let's make sure that we instill into our communities. It's time to eat healthy. It's time to exercise. It's time to support and understand that starting from where we were, we understand a lot of things now. As Dr. Boykin has said, we came into this blind. We have a lot of mitigation factors, a lot of issues that have been resolved, a lot of questions have been answered. And yet still, we still battle the one big question: why the misinformation? Why the disinformation? Please understand, we're here to say life, one day at a time. And if we can do that here using this call, we have succeeded. I know for myself, a number of family members, a number of fraternity brothers that I love have gotten vaccinated just because of this call, this webinar. And that's all I needed to hear, that I made a difference in someone's life. Now let's understand. We started in the dark. We started in a mystifying situation where we were dying. Our friends were dying of an invisible enemy. Yes, we have been at war for almost 20 something months, but we have the tools. We have the protectors. We have the shields that can save lives. Please continue to provide the correct information. Use the correct sources for the information. I understand the vaccines. There's a lot of mystification about them in the past. There's a lot of information. Now, we've had up to 81% of people in America 5 years or older to get at least one dose. That is amazing. We still have to continue to move forward. The majority of our country is having low incidence rates, and let's keep it that way. But stay vigilant. Stay vigilant.
Dr. Guyton, I'm just going to, we don't want to stay here for a long time, but I do want to touch this only because we're talking about vaccines. Now, we do know, obviously, that there are some people, very small number, and I have to defer to any of the doctors that have the actual stats. But obviously, we know that everybody did not respond well to the vaccines. Dr. Guyton, since you mentioned that, can you just touch briefly? Just because you got the vaccine, the purpose of the vaccine, because I hear some people say, I was fine uh, since I took the vaccine. Now I'm having these side effects, or things are happening to me as a result of the vaccine. Can you just briefly explain the purpose and possible side effects that may have happened to some people?
So brothers, great question, Brother DR. As you take any vaccine, if you've never been exposed to it, your body does something very terrific. It builds a group of friends, and it protects you from that enemy the next time it's exposed. But immediately that body has to build antibodies, T cells. They have to build that immunity up. And guess what? Your body reacts to that and builds you that particular immunity level each time you got the dose. Now, I had body aches and chills the first time I got the shot. I also had that for flu 1 year. But that is your body doing its job. The second dose, I had body aches. The third dose, sore arm. My body was reacting to the vaccine the way it should have. Now, you're going to have people that take the vaccine and still may get sick. We didn't say the vaccine was a cure, but that vaccine did prevent hospitalization and death. When we say 95% of the time prevents you from going into the hospital and death, because when you go into the hospital, you go into the ICU, there's a high prevalence that you're not going to come out of there. So what you want to do is stay out of the hospital. You want to stay out of the ER. And that's what the vaccine does. It gives you that level of protection. It infuses and forces your body to become your shield. It enhances your ability to react to this foreign enemy that it cannot see. But it does not mean that you may not get a version of the virus that may cause slight infections or side effects. Now, let's go back to side effects versus the virus. Side effects from the vaccine will be normal. The virus will, at some point, if you get a mild version, will cause some symptoms. Side effects versus symptoms. Let's be clear on that, okay? Now, some people got the vaccine and they say, well, okay, they died. They had a problem. Well, there are a number of complications that may have led to that. It is never 1 + 1 when you're injecting this virus into a body of a human being that has other comorbidities that may have caused their mortality rate to increase. But again, tying those together is what we've had with this disinformation and misinformation campaign. Colin Powell, my greatest hero, we could give him 1,000 vaccines, but because of the blood cancer that great hero had, if he ever caught it, we don't know how he would have reacted. And we saw what happened. He had the vaccine, but his body prevented him from fighting as he fought for us over the years.
And we've got some former presidents right now that have tested positive.
Let me just add another personal experience with the vaccine in and of myself. I share the same diagnosis that Colin Powell did. So I got the first vaccine. I got the Moderna vaccine. I had just some soreness, and that was basically it. The second time I got the second dose, I had fever, chills, headache, the whole 9 yards for about 36 hours. And so then I went and got the third vaccine, or boost, if you will. We call it the third dose for us people that are people with cancer. And so maybe I just had a sore arm, a little bit of chills and things like that. And I recently got the fourth dose because of being on chemotherapy. I got the fourth dose, and guess what? I didn't have a single side effect. Maybe just a sore arm for about a few hours afterwards. I was going to rush home and take my Tylenol and hydrate, things like that, but I did not. So it's all, I said all that to say this, it's all individual how you're going to react to it. It's not everybody's going to react the same way. Just like we know some people get the disease and never have a problem afterwards. Some people get the disease and need to have the vaccine if they get it again. We know that. We never said from the beginning that the vaccines are going to prevent you from getting the disease, because no vaccine out there does it. If that was the case, we make one vaccine and be done with it. And so far, we haven't done that. There's only a few diseases in this United States of America that have been eliminated by vaccination. And some of those because we self-contained in the United States, such as smallpox and polio. But it doesn't mean that polio and smallpox are not out there in the wild. We just have found a way to effectively eliminate the United States. So the vaccines were probably the biggest thing that protected us. When we had the most deaths and diseases, it was during the Delta campaign, the Delta virus. Okay, we looked at that's when we had the biggest impact. Just when the vaccines was just coming about. So along comes Omicron. So we already know what to do about it. And the unvaccinated group, the highest incidence of hospitalization was what? The kids, because we could not vaccinate the kids. So I say all that to say this: the vaccines do what they're supposed to do. They prevent you from getting severe illness and hospitalization and death. And as I said, no vaccines out there are going to completely prevent you from getting the disease. So the side effects, in my opinion, are very, very minuscule as opposed to the seriousness of getting COVID. Anywhere from mild symptoms with COVID to death. And unfortunately, there are some senators in the United States Senate right now that have long haul COVID and they were vaccinated. So there's no guarantee that COVID's not going to hit you in some form or fashion.
Dr. Phillips, you want to chime in on that?
Yeah, I just wanted to just underline what the brothers said. I mean, like all of us, we get the calls from anybody that we know that gets COVID. And I saw with Christmas, holiday, and New Year's, so many people that were getting COVID and they got mild COVID. And I believe in part it was mild for them because they were vaccinated. So each time they called me, I said, amen to that vaccine, because if you weren't vaccinated, we might not be having this conversation right now. So again, even though the cases jumped up like they're jumping up now, in New York, we've seen a 10% jump in the past week as far as the number of cases. But again, those cases did not connect to increase in hospitalizations nor connect to an increase in deaths, which we saw in the earlier waves that we have encountered. So I definitely would agree that this vaccine is really, for those that have chosen to take it, it's really provided them with some protection. Now, for those that have not wanted to take it, I think what we are still seeing is that if you've got health issues that are not in control, that you need to start working on them right now. If you've got diabetes, you need to get that A1C down to a workable number. If you have heart disease, if you are obese, because again, in talking to my emergency room colleagues, the ones that they are sending up to the ICU that they're intubating still, in most parts, are those individuals that are overweight. So again, if you don't want to get vaccinated, what are you doing to boost your immune system? Because vitamin C, turmeric, vitamin D, zinc, that's not going to do it by itself. That's not going to protect you by itself. If you are about this non-vaccinated path that you're choosing, you're going to have to be committed to those immuno-boosting and lifestyle activities every day with the same intention that you would take a medication. And if you're not doing that, unfortunately, you could still mess around and get caught up by BA.2.
Wow. Wow. Dr. Phillips, let me stay with you. Let's go to where we are now. Let's just look at it. Here we are. We're at the end of the month of March. April, everybody's getting ready. Easter's around the corner. It's getting warm outside. If you're down here with us in the DC area, the cherry blossoms, we already doing the Mardi Gras thing. People are hanging out. Talk to us about, these gatherings, whether it's family gatherings or just out in public. I mean, I obviously I do not see the mask being worn anymore. Talk to us about where we are now.
Well, I think that, people got to look at their risk, and they got to look at the risk of where you're at as far as the local incidence of COVID. They got to look at what type of population they got coming in. I mean, I know for me, I'm a person that now looks for outfield seats. Wherever I am, I'm looking for outfield seats, meaning I want to stay to the periphery because I don't want to be up in the middle of everything. If I'm in the periphery, I feel like I could safely, if I chose not to wear a mask, not wear a mask. But if you're in a collection of people, you got to be careful. And I think we're going to see coming up. I mean, I know, what did they just put South Beach, Miami on lockdown? So that means that those individuals, they coming back home. So that is going to be the beginning of seeing where we go, because unfortunately, as we've alluded to, our communities still run the lowest rates of vaccination. So that means that we still have what I feel to be a significant risk of COVID. So my advice to people is you got to assess your personal risk. Now, as Dr. Boykin just said, we've got multiple layers of weapons that we can use to protect ourselves. You mentioned one, Brother DR, the mask. The other one we've talked about, Dr. Guyton talked about, is the vaccination. The other thing that we have is the testing. I took a test before I went to Harrisburg. I took a test when I came back just to confirm that I was good. Because again, yes, you're right. We are in the midst of individuals acting like this never happened before. And I think, that's human. Those are what people like to do. People like to, it's like having an argument with somebody and make up, and later on they want to act like that argument never, ever, ever happened. And I think that you see people that are trying to forget about COVID. And I don't think they want to forget about it because they just want to ignore it. But I think it speaks to how damaging this time has been for us as a collective. And I think the other part is, in my, layers of protection, is what are you doing intentionally to work on your mental and spiritual well-being? Because those are the things that make you tired to say, you know what, I'm not doing this ish no more, man. F that. I'm going to just be out. And unfortunately, if you're a person that may have health issues, obesity, things like that, that little moment can turn into something that you can never change. So I am saying, as far as where we are now, as I said earlier, we are moving from a pandemic to now being considered an endemic, which means to me that the powers that be are saying this is your responsibility to protect yourselves. And I think that there are a lot of information out there that gives you the steps that you need to take to protect yourselves.
Let me get Brother Gardner's perspective as far as where we are now. The government has done a phenomenal job, as far as I'm concerned. They provided the opportunity for people to go and register for their kits, if you will. We received ours. I know many people received the kits. But as far as the federal side, mandates, and just make sure you come off mute so we can hear all the good stuff you're about to tell us. As far as, mandates, at least from what I've seen, there's some requirements of, if you're going certain places, obviously the airports, you still got to wear your mask, things like that. But talk to us from that perspective, where we
Sure.
are now from the
Brother
government.
DR, I'd like to pick up first of all where Brother Phillips was just talking about going from a pandemic to an endemic, and that has not been called yet, but I do think it's going to happen pretty soon. But after the State of the Union, there was a collective shift in the psyche of America after a 2-year battle with the haves versus the have-not, those that believe science versus those that didn't believe science. It was as if by a mere statement by the President of the United States, we are no longer facing this thing. And so we've all been grappling about what does this new normal look like and what does it mean to the average American. And to what Brother Phillips talked about, I think before it was as a collective, the federal governments or government institutions took it upon themselves to feel like they were in charge and had to make decisions for the masses based on disinformation and innuendo. They tried their best. But I think after the State of the Union, there was a seismic shift to say now the responsibility is on individuals. And I think we need to really hit on that. It's now more on individuals, where government still plays a role in it, but it's more on individuals. And that's even more so articulating the fact that right now, there's no money in the U.S. governmental budget for 22 for additional COVID vaccinations, the additional COVID testing for Americans. So what does that mean? Like right now for Pfizer and Moderna, who are taking orders from other countries to produce vaccinations for them, we as a nation have not said we're going to buy or have a stockpile. That's very disconcerting to me. And why is that true? It's because we as a nation, we're tired, we're exhausted, misinformation, distrust, and a political divide over something that should have been very simple about a vaccine has gotten into the fabric of America. So you asked about mandates. I think mandates are going to be a thing of the past, with the exception of public transportation and hospital areas and areas where they are likely to have immunocompromised officials, as I was saying earlier. So listen, Dr. Fauci at a conference we were in just last Tuesday, one of the comments earlier was that he's kind of given up. I wouldn't say he's given up, but he's faced the reality of where we are. We are a war-torn, PTSD-driven country, and we're tired, and we want to act as though this has gone away. My fear is as we reopen America, as we get to what we call a sense of normalcy, we're gonna have peaks and valleys. And what all of us are having concerns about is what do we do when the next surge comes and we have to ask Americans to either buckle down or step back. It's hard to do that. It's like the old adage says, measure twice, cut once. Well, the powers that be have decided that we need to turn the corner and do a new thing. My concern that has been articulated here is we as a community, we were the last ones to get the vaccines. We were the last ones to step up. Our numbers were never as high as they should have been. So we are the most vulnerable population as we go back to this new normal. And so the concern is, just like in everyday life, we now have to have the added burden of making sure we are risk averse as much as we can be. We talk about vaccines, we talk about masking, we talk about social distancing. But in a community who are engaged in being close by to each other all the time, that's very hard to do. I go to the Alpha Street Baptist Church. We are trying to open our church back up on April the 3rd. Okay. a church of 10,000 members, we're going to have service with 250 members at a time by disciple groups. We have members that are very, very upset about that. My pastor said something that was very telling. He said, Wonzie, to the rest of the members, says, Wonzie, what I have to do is sure that the least of us are protected by the most of us. Okay? The least of us have got to be protected by the most of us. And to me, that's a good word for tonight. We need to look at the least of us and see how the most of us can protect those. And those are the vulnerable big mamas or the vulnerable kids that have not been vaccinated. Those are the vulnerable brothers and sisters who have not shared in the education process and for whatever reason have decided they do not want to get the vaccination. If I can bring it further home here, as we go back to re-enter to some kind of work environment in the federal government, the private sector, and masks are no longer required, we've got to make sure that we take care of those people that for whatever reason, they either get vaccinated or for whatever reason, they're still immunocompromised, or for whatever reason, they're trying to get them a life. So we need to make sure that we have what I call kindness factors, where we don't look at necessarily at ourselves, but at other people. And one of my colleagues said it the best the other day. He said, my rights end where your rights begin. Again, my rights end where your rights begin. I remember a time in the United States where we were all about the collective. I'm not sure what's happened in the last 20, 30 years, but now it's all about me. This is one time, Brother DR, that we still need to look at the collective and try to figure out how we do that. So again, my mantra tonight is my rights end where yours begin. And the most of us have to take care of the least of us as we move forward through this endemic and pandemic period we're going through.
Now, listen, Brother Gardner, you always talk about how, you're blessed to be among the best and that you're not a doctor. I can't speak for the doctors that's on here, but all I'm saying is tonight you preaching, my brother. You are preaching. So keep it up. Maybe we can't make you a medical doctor, but we certainly can consider making you a doctor of the word. My goodness.
Well, when it comes from the heart, and when you have gone through what I've gone through in long sleepless nights, you tend to get close to him who made you and recognize that you're just one small pod in his wheel, and that I'm leaning on all you guys. So I'm standing on the shoulders of greatness here, just trying to do my part.
Man, and I know we all appreciate you. Dr. Guyton, go ahead.
One of the things I want, and I think Wonzie really hit on it, and Brother Phillips did, is about the mental fatigue and the fog that we've been through, the PTSD. We cannot stop the vigilance because we're looking at, I think, less than 11% of our African Americans being vaccinated fully. We're looking at a hay fever and a flu season that's still apparent. I want to make sure that you understand that in this time, a simple sinus infection, a simple sniffles, don't confuse that and take that very lightly. I think we were getting relaxed and traveling to Miami myself and seeing people without masks. I was very uncomfortable. That's why I went to outside events. If I walked into a cigar lounge, I had to come back out because I was nervous. And I know a lot of people now are going to be feeling that nervousness just going back into the workplace. So we need to really start looking at how we are going to do wellness, and wellness being mental health wellness, mentally counseling and understanding that being vigilant and being, it's most like, for me, it's been like riding my motorcycle every day of my life. I've got to watch my periphery. I've got to watch my mirrors. I got to concentrate on my hands and my feet. And then I got to watch what's in front of me, every speck of the road. It is that tension that continues to build in our bodies that is not good for you. My mom always said pressure busts pipes. So what we got to do is continue to be vigilant, continue to understand the mental health aspect of it, and continue to push in our communities, the least of us, which is the less than 11% of us that have not, have only been vaccinated, have to help the other 80% of us. Let's understand that we're not out of this. I'll give you an anecdotal story. We've gone through this for 20-something months. My mother has been vigilant, not going to church, not going to the store. She went to church. She went to Walmart. She had the sniffles. She went outside and mowed the yard. This is a Wednesday. Sunday, she thought nothing of it. Let me check my results. She was positive. She was positive because she had got comfortable and she thought it was just a cold, a head cold. And I told her, Mama, please thank God, but you better realize you better thank that vaccine. You're 71, you have a couple of morbidities, and you got a third shot. So please understand, we need to stay vigilant. We need to make sure those mitigation factors are in place. And I never travel without looking at the community incident rate. I never travel now. That's a part of my travel plan, is to know where I'm going and how bad it is where I'm going. And do I need to carry my mask? Over.
Dr. Boykin, I think we've talked about obviously where this thing began, and we've certainly talked about where we are now. I'm just wondering, can we hear from your perspective as it relates to the pediatrician side? Obviously, there was talks as it relates to the kids from the vaccination standpoint. Then this whole mask thing. Now the masks have been lifted. Can you give us an idea of where we are now? Where are we moving forward, especially as it relates to the little people in our lives?
Well, I just piggyback off what Wonzie said. The most of us have to take care of the least of us. And then this is where masking comes in school. We have to realize that where we started with medicine in pediatric world, there were kids that couldn't go to school for various and sundry medical conditions they had, such as cystic fibrosis or some other incompetency. And so, we got to look at that aspect of it. We try to normalize things, but we can't say that one rule fits for all, because we can't say take away the mask in school, because those kids that have those diseases still are trying to go to school. So we got to make some type of consideration for that. And it's a sad state of affairs that we have to sue in this society to have regular medical care. That's what distresses me the most about going forward. We have to sue. People are suing because they think it's a violation of their political right or whatever, their constitutional right. Then people have to come behind them and sue, because I think, well, your rights end, my rights begin, as Wonzie also said. So when your child may be healthy and going to school without a mask, my child has cystic fibrosis on 1,000 medications just to stay alive, and you say no masking in school, I have the right to wear my mask. It's like I wear my mask wherever I go now, because I don't know where people have been. So, if we look at the kids, people say our kids don't get COVID. Healthy children don't get COVID. Well, you tell them that the mother of that 11-year-old child who was healthy, who was the school nurse assistant who took all the sick kids to the office, and she came down with a viral-like illness. And most people say, well, most kids just get a virus, it's not a big deal. Well, to make a long story short, she turned out to have COVID, and she died in the emergency room because there was no vaccines for her at the time, and because people thought healthy children don't get a COVID, when then we know it's a big myth. So we got to look at that. There's still a significant amount of people out there that are vulnerable, and I always call these children with special health care needs. You may not have a physical need, a physical health thing that will impact you with getting COVID, but as my other brothers said on here, let's look at the mental aspects of it. Kids are going to hear all these things. They don't know what to believe, so they look up to us older people and parents as what to do, and the kids are afraid. When kids don't know what to do, some of the older kids do? What do? They go out and they commit suicide, or they go out and they do risky behaviors. And I tell you, one child that lost to suicide or other risky behavior, to me, is a dagger in my heart, because I've practiced for years and years and years to help children not think that their suicide is the way out. But they don't know who to talk to, because there's such a divisiveness in the country about, well, you don't need to wear. You go to school, you tell them that they're violating your rights. Well, you don't know who this child is sitting next to, what they have, where they've been, and where they've come from. This has been a long 20 months for them. They're worried about, are they going to have a place to live, because maybe the parents couldn't go to work, or whatever. Maybe their utilities are going to get cut off. So all those things have to be taken in consideration as we move back to some sense of normalcy. Going back to school, I get it. I get it. We need to have all our kids in school, but we need to stop saying things like wearing masks causes some detrimental developmental things without any scientific fact. It's sad to say there are some pediatricians out there saying that they have evidence, and they practice for less than me, that they have evidence that mask does affect the development of children. Well, I haven't seen any evidence from the American Academy of Pediatrics that states that to be true. So I think the misinformation needs to stop. If you can put something out there, you may have some anecdotal things. All of us as physicians have anecdotal cases of something happening. I remember when pycnogenol first came out, I used it for a kid with ADD. It worked for a few, but it didn't work for many. But it doesn't say it didn't work. But I didn't go out there and say this is the definite thing to do for ADD. So we can't say the same thing about masking. We have to protect those kids that are vulnerable to it. Also, was often overlooked and is a big time endemic in this country is pediatric obesity. So we know obesity is a big risk factor for COVID-19 severity. So all those things have to be taken in consideration. Kids that can't eat, they want to take away the school programs for eating. Sometimes it's the only place these kids get meals at, because what they eat at home is probably not healthy if they can get anything to eat at all. So all those things are what we got to consider for our pediatric population. But just remember, how you respond to things are looked at by your children, and the children are afraid. So take a look in the mirror at what you're doing and what you're saying, and remember the little ones are the ones we have to protect the most, because they are our future.
Dr. Phillips, I want to go to Dr. Phillips, then I want to go to Dr. Guyton, then I want to get ready for our closing statements, because as always, this information, we just simply just don't have enough time. Dr. Phillips, let me let you chime on that. Going forward, what do we need to be aware of? What do we need to be looking at in other countries, maybe? But as we move forward towards this endemic, what are things we need to be cognizant of?
I'm just going to first comment on what Dr. Boykin said. Let me just say a couple things. You have second graders who have never been in a classroom with kids before. Think about how you would be different in your development if that was the case. I'm in graduate education. I am seeing college graduates who have thought all their life that I wanted to go to medical school and had to take a year, 2 years maybe, to put that on the hold, put that mission on hold, and then revisit it. So I think all of us need to really recognize that we need to lean in to our young people, because some of their professional and life aspirations could be impacted by the disturbances that have occurred so far with this pandemic. So as far as what were you saying, Brother DR, where we're going with it? As far as where we're going with it, I think a couple things we need to be mindful of. I think we need not to forget the contribution that chronic diseases not being managed appropriately during this time has contributed to not COVID death only, but also things like heart attacks, strokes. How many of us right here know bros that have had a stroke or a heart attack and may have died in the past 2 years and had nothing to do with COVID? But it had to do with, was that individual on top of their chronic care? And I think it's important for us to recognize that the fact that it's a pandemic, your blood pressure don't care about that. We have things like telehealth visits now, so you can still stay up to speed with your prescriptions, with the testing that you need to do. I just had a patient I had to reach out to today because they had to follow up to get a colonoscopy, and they've been off the grid for about a year now because of COVID and their difficulty getting in the office. So we had to reach out to them today emergently, like, bro, you need to get this taken care of. But I think that it's important for us to be intentional on staying on top of our preventive health, because again, for those that say, man, I'm not getting that vaccine, what are you doing to protect yourself? Because like I said, vitamins by itself is not going to do it. If you have health issues, you got to stay on top of them. If you are a person that is overweight, what are you doing about that? How are you changing how you're eating? Are you doing any exercise? Yeah, we can't go to the gym, but we've got to use other mechanisms. Go out for a walk, learn how to work out in the crib. These are things that need to happen because, again, as we move forward, this COVID thing is going to be here like a bully sitting on the corner waiting for anybody that he feels that he can mess with that's walking his way. And if we don't do the things to protect ourselves, next thing you know, you're going to get collared by big man COVID. And he's going to pick you up off the floor, and it's not a good thing because it's not only just, can I get sick? What have we also seen? People losing their jobs, people that may not have the ability to Zoom, work from home, or better yet, the ability to have sick days or take leave so that they can accommodate their COVID. Those things are not happening anymore. And what did we just hear? The federal government did not approve additional funding. So all of these things that we may have had in place, they may not be there anymore for you. Free vaccinations may not have that anymore. So what are you going to do to protect yourself? Because COVID bully is standing right on the corner, whether we like it or not.
Powerful, powerful. Dr. Guyton, and then we're going to get ready to go around for our close. Dr. Guyton.
So one of the things that I want to make sure I keep reiterating is that we are not out of this totally. We have to stay vigilant. We have to stay smart. And the accountability factor is now back onto us personally. The federal government has stood up, done a magnificent job of getting us through the worst of it. And now they're asking and formalizing the accountability factor, where you have to be accountable for your health of your kids. So let's not forget, as we look at this silent killer, the impact of the mental health aspects of it and behavioral health aspects have not been totally felt yet. As we move forward and we're coming out of this closed system where we've been separated, coming back into the work environment, we have to be prepared for situations that we've never seen before. We've got to be able to uplift and understand, not judge and debate with, because we can't get past this without each one of us helping our brother or sister. In this country, it's all been about self. So we got to get into a mindset where it's about the community. And that's why we're here. That's why we've been here. That's why I do what I do every day. One person, one day at a time. That's all I can do, and that's all I'm trying to do. Where we need to go, we need to keep understanding the need for vaccinations, the need for the mitigation factors. Now, we do have oral medications, but again, they are limited in who we can use those on. So you can't count on those. Vaccinations, community vigilance, understanding our mental health impact, supporting our brothers and our sisters. That's where we're going. And that's the way we get out of this. Because believe it or not, it's going to be with us for a while. And that bully is sitting there now all in black with shades on in the dark without the street light on. So you won't see him coming.
You said we don't want to see that swing, huh?
Brother DR, Brother Guyton keeps hitting me upside the head when he keeps talking about that mental health piece. I call myself a pretty A-type personality, pretty strong dude, a fixer and all that kind of stuff. And I want to share real quickly, I got a physical and everything looked good. But one thing, my resting heart rate was like 145, 147. And my primary care physician said, Colonel Gardner, what's going on with you? I said, nothing. She said, everything is good, but your resting heart rate is 145. She said, sit down. Next thing I knew, they had me hooked up to another machine. Did a bunch of tests. Still up there, and she asked me, "What's going on with you?" I said, "Nothing," and they kept going on. And finally, the big guy came in from Fort Belvoir, and he said, "Wonzie, we don't know what's going on. We're thinking about admitting you because this is too high for resting heart rate." And so he said, "What's going on in your life?" I said, "Nothing. I'm fine." I said, I jokingly said, if you want to talk about 20, I lost 3 family members, 7 of my, and then my doctor looked at me and said, "You're clinically depressed." What? Me? Clinically depressed? What does that mean? It scared me half to death. And so they called me down, talked to my therapist, a real good therapist, says, "Wonzie, I've been trying to tell you." And in layman's terms, I got doctors here, so you guys forgive me when I say this, I may say it wrong. She said that Dr. King said to me, she says, "Wonzie, the body has a way of protecting itself if you won't protect it. You say you're good in your mind, but your body's saying something totally different." So they gave me, and this is we're family. They gave me wanted me to take some antidepressants. I freaked out because Black people, come on, me. And so I said no, and they prescribed some things for me, and it was all good for 2 days. And then I started having really bad nightmares. And I got up one day, I was missing my daughter. And I just freaked out, and they told me call the doctor. And the doctor asked me 2 questions. He says, "Wonzie, when you're having your nightmares, this is like 2 weeks straight, when you're having your nightmares, Are you talking about things, seeing things that you want to change in your past, or are you just having nightmares of doc? I'm having nightmares stuff I hadn't even thought about. I mean, just bad, waking up tired. So this is medicine. So they changed the medicine, gave me another pill, very low dose. But I want to tell you guys here, and I think we can all understand this. They told me basically, sometimes you look at medication like liquor in a pill. You get that little mellow thing. So I'm taking some stuff because, Brother Guy, you said I have post-traumatic stress from COVID. Didn't know for 2 years how long I was running with this. They put me on some medicine, and now my heart rate's about 117, 118, where it's supposed to be. Didn't know this. I could have had a stroke and died because I was running so fast. And for us, being stressed out can start becoming feeling normal. My normal state of mind was being stressed. I didn't even know. I'd wake up stressed. My neck was hurting back here, had all the signs and everything like that. And because of this group, and because of things I read, because of being able to share with you guys, I think I might be alive because that one little pill I'm taking now has got me where I can just keep here. I have those ups and downs. But getting back to what Brother Guyton said, we as Black men, we've got to get over this this stigma about mental therapy. We got to get over this stigma about taking things to alleviate the mental pressure you're having. And like I said, I thought I was a strong dude. I thought I could solve anything, but there's certain things I can't fix. And one of the things I can't fix is my past. One of the things I can't fix is what's going on in my head. And so I don't say this in an ashamed way, but I say this in a way that I know there's some brothers out there that have gone through some things that feel like you got to go to the bottle, you feel like you got to go to here. But there are some medical things out there that can make you feel okay and keep you on the right track. And I'm hoping that tonight there's a brother out there or a sister out there that will hear me, and I call it courageous talk, to say I'm not whole unless I tell you the truth, what's going on behind the closed doors. You may see that smiling face, but the scars are there. The pain is there. And through prayer, through a good church, through a good therapist, and through a good medical doctor, I think we're going to be okay. But I want you all to know it's okay to say I'm hurting. It's okay to say I'm bruised. It's okay to say that I need help. And one thing I learned through this whole process is that when we lean on each other and we're honest and have what I call real Q talk, real discussions about what's going on in our lives, we can help each other. We've got to get beyond that farce of I'm this and what I'm doing, but recognize that we're all one catastrophe away from going crazy. We're all one bullet shot from being dead. We're all one this. And so I just want to make sure that I told you all the rest of the story, not there yet, but I'm going to get where I need to be because I know how to go out and help myself do the things I need to do.
Bless you, man.
Yeah.
I mean, as always, just, from the heart, we got 30 seconds for each of you. So let's get that closing statement. We're going to start with 78, Dr. Boykin.
Thank you, Brother DR. I just have one thing to say. I mean, the most powerful thing has already been said tonight. And you just heard from Brother Wonzie. Have a plan, guys. All of us have talked about it tonight. We went here, we went there. Just have a plan. Just remember, take care of yourself and take care of those others around you that are going to be impacted by what you do. If you live with somebody or in contact with somebody socially that are high risk, remember, where you go, you bring back to them. So keep that in the back of your mind. And the other thing I think Brother Guyton said is that just because you have springtime allergies, don't take it for granted that you don't have something underlying, especially if you have some other symptoms such as a sore throat or a cough or something like that. Just remember, it's easy now to get tested. I mean, you can walk in any pharmacy these days, and right up at the counter where you check out, there's COVID-19 tests. So do what you need to do. And if you're one of the people who believe in vaccination, get vaccinated, because you will see that we're having much decreased cases and deaths and hospitalization. And I think it's a direct effect of those who've been vaccinated. If you don't want to get vaccinated, that's your choice. But just remember to protect yourself so that you can protect others. Thank you.
Thank you, as always, Dr. Boykin, giving it to us straight. Let's go to Dr. Phillips.
I just echo what Dr. Boykin said. We got to take a preventive approach with it, y'all, because, again, we got to look at what our personal risk factors are. But as he alluded to, you got to also look at the people that you're around and what you could, and if they're vulnerable, what you could bring to them. So I think if you have elders in your family that are not vaccinated, the best thing you could do for them is encourage them to get their vaccination. If they're eligible to get a booster, I think you're doing them a major, major help by encouraging them to get that booster, because again, as we look at who is shown to be the most vulnerable to Omicron BA.2, it tends to be individuals that are older, individuals that have immunocompromised conditions. So we want to make sure from a preventive standpoint that we are protecting ourselves with all of the tools that we have. And last but definitely not least is all of us have some level. I know I've been feeling moments of depression and anxiety, that has come and gone. And, again, when you get news that the numbers are going up, or that you can't do this or you can't do that, this has been over two years of solitary confinement for a lot of us. And that's not easy. And I think, again, we have to be intentional, not only with our physical health, but our mental and spiritual health. So with that, again, y'all, we still have to protect ourselves and protect our communities. Because as, Brother Gardner just said earlier, unfortunately, it's going to be the few of us that are going to be protecting the most of us, because 11% vaccination rate gives a lot of vulnerability to us.
As always, Dr. Phillips bringing it to us, you know what I mean, like the way that only he can do. Dr. Phillips, we appreciate you. Brother Wonzie, I mean, what can I say? Go ahead, give us some closing remarks, my brother.
My brothers, I just thank you for this opportunity. And I'm reminded of an old saying that Grandma used to say all the time about the power of us. The power of us is far greater than the power of me. And so I just thank you all for this opportunity. And I just thank you all for allowing me to lean on you all and picking me up over these last 2 years. Don't know if I could have made it without this body and this opportunity of finding my own personal therapy. And I just love on each and every one of you guys so much for giving me the encouragement and the strength to get up every day. It's been tough, but you guys have made it worthwhile. And sometimes you ask yourself why you are faced and put so much to put on your shoulders, but there's a reason why. I don't know why. But as Brother Guyton said, if we can just help somebody to get through this, it's worth it. Thanks, Brother DR.
Thank you, Brother Gardner. Dr. Guyton.
Brother DR and brothers, I first want to say, Brother Gardner, love you, bro. You all have been a light and a guidance in my life. As I work daily to help save communities around this country, it gets hard going through bats of, depression. Am I doing enough? We can't do enough. We can't stop this, because we've been in a war with the greatest enemy we've ever known that we can't see, and we didn't have any tools or weapons to fight it. That's how bad it was. Look at God. Look where we are. What we have to do is keep remembering we are here only because we have people like Brother Gardner. We have people like Brother Phillips, Brother Boykin, that are getting out there, getting the information out, and getting involved in our communities. Don't take it lightly. We have been in the worst war ever, and we've lost over 900,000 people, but we are alive. I'm happy to say that I am alive today because of knowing and having the education level of knowing what is the right thing to do. So for those that we know do not, love them, encourage them, ensure that they have the information, save one person one day at a time, and we'll get through this. Please ensure that you understand that not being vaccinated, that's a choice. Support that choice. Make sure that you as a person can help that person who decides that they can't trust that vaccine. Make sure they understand the importance of being healthy. Make sure they have the understanding of their mental healthiness, because mental health is going to be our biggest task right now in our communities. Again, thank you all. I'm alive today because of being in my fraternity and being in the right place at the right time and being blessed to serve this whole country. Thank you.
Thank you, Dr. Guyton. And Piercy, I'm gonna put you on the spot. If you could give me one shot with all of us on here before we close. I think it's imperative that all of you, who we know as the Four Horsemen, the work that you've done throughout this pandemic, you've taken the time to make sure that not only the brothers of our fraternity are informed, but members of our community. And I just want to share, two things very quickly because we're over time. They're going to charge us. First thing is, at the beginning of this thing, I'm not ashamed to say it. At the beginning of this thing, I had no plans of getting vaccinated. I said I wasn't going to do it because I didn't know. But it was the four of you, listening to the four of you, not only because you're my brothers, but because you took the time to do the research. You took the time to get vaccinated yourselves, and you made sure that everyone knew as much information that was available as it became available, and you never stopped. So I just want to publicly, and I believe all the people that have joined us week after week for the brothers, every other week for some of our family and community members, and certainly when we introduce this webinar, those across the globe that tune in at a time that's convenient for them to hear the words of wisdom, the knowledge that you impart to us. We just want to say thank you. You all have changed lives, but most importantly, you all have saved lives. And nobody's perfect. So we couldn't save 100%. But the point is, we saved. And so, again, to the four of you, the four horsemen, thank you. On behalf of all of the brothers of the second district, I say thank you. Hopefully, on behalf of the Grand Bostas, he would allow me to say the information that you shared with him that has allowed him to make decisions on behalf of the fraternity. It was because of you all and your wisdom and your knowledge. And most importantly, we know perseverance. You all did not stop. So we appreciate you all. Thank you all so much. So, with that being said, brothers, friends, family, again, we thank you for joining us. We'll be here again next month. And I can honestly tell you, I don't know what's going to happen after next month because, at least for me, there'll be some changes. So we'll see what happens in April. You see the smile on my face is going to be that much bigger come May. But again, you've heard from our doctors, you've heard from our brother Gardner. We must continue to be vigilant. And I think all of them said it great, but I think Dr. Phillips, you said it best. You have to make a self-informed decision about your health. You've gotten the information, you've heard it from the doctors. You make the best decision for you. Those of us that wear that purple and gold, we know the saying, do thy duty that is best. And we know the rest. With that being said, to our producer, Brother Piercy in the background, we appreciate you. Our other producers, Brother Tim Worley, making it happen. Brother Ed Hill, Brother Jeff Givens, Brother Gabe Brown on our IT side, making sure that the entire world gets to hear the Four Horsemen. We salute all of you. We thank you. Brothers of the Second District, we love you. Brothers, friends, and family, have a great evening. We'll see you next month. God bless you.